All right, let's jump right in. We have this habit of putting our health into these neat little boxes, right? Like, here's your heart health, over there is your brain health, and way, way off in its own little world is your oral health. But what if what's happening inside your mouth could have a direct, and I mean powerful, impact on one of the most important processes imaginable, a pregnancy?
It sounds a little crazy, doesn't it? But it's a real question at the heart of some fascinating and, frankly, crucial medical research. The evidence is starting to show that for some expecting mothers, the path to a healthy pregnancy might actually begin in the dentist chair. So how on earth are these two things connected? Well, it all kicks off with one absolutely mind-blowing number.
Just look at that. 256%. Let that sink in for a second. According to a major study, that's how much a pregnant woman's risk of developing preeclampsia, a really serious complication, goes up if she has severe gum disease. I mean, come on, that's a gigantic statistical link. It's the kind of number that makes scientists sit up and say, okay, we have to figure out what is going on here.
So that's the what. Now we've got to get into the how. How can a simple infection in your gums possibly mess with a developing baby and the placenta? Well, the main suspect has a name you've probably heard, but maybe don't know exactly what it is. And here it is, periodontitis. Now, this isn't just about seeing a little pink in the sink when you brush. Nope. This is a chronic, serious inflammatory disease. Deep pockets form between your gums and teeth, and they become the perfect little breeding ground for all sorts of nasty bacteria. And right there, that's where the chain reaction starts. So let's follow the trail. Think of that gum infection like a fire alarm in your body that's just blaring 24/7. First, the bacteria are having a party in your gums. Then, they find a breach. They and all the inflammatory junk they produce slip through the inflamed tissue and get right into your bloodstream. And from there, your circulatory system turns into an accidental superhighway, zipping these little troublemakers all over your body. Eventually, they can reach the placenta. This puts your whole system on high alert, creating what's called systemic inflammation, which is what researchers believe can trigger some of these really serious pregnancy complications. And scientists have even got a lineup of the usual suspects. I mean, look at these names. These are some of the key bacteria that have been found not just in those gum pockets, but also, get this, in the placental tissue of women who had complications. Porphyromonas gingivalis and Fusobacterium nucleatum. Those two in particular keep showing up, proving that these microscopic bugs can and do make that incredible journey from the mouth all the way to the womb. Okay, so the theory is solid. It makes sense. But a good theory needs good evidence to back it up. And when you start digging through the research, you find a really compelling, but also pretty complex picture starting to form. And this is a perfect example of how science really works, It's not always a straight line. On the one hand, you have a ton of studies showing a really strong connection. The data's there. But on the other hand, it's clearly not a simple one-to-one cause and effect. The fact that some studies don't find that same strong link tells us that there have to be other things involved, factors that are unique to the person, not just the disease. Let's just look at a few of these. So you have studies like Kanakchi and Cotter, which both focused on preeclampsia and found that, yep, there's a significant link. Then you have a team like Vogt, who looked at it a bit differently. They measured the total oral inflammatory load and found it was over 3 times higher in moms who had preterm or low birth weight babies. Every single study like this adds another piece to this giant puzzle. And all of that brings us to the next, really fascinating layer of this whole thing. If not every person with gum disease has these problems, what is it that makes some of us more vulnerable than others? Well, the answer might just be written in our DNA. So this is the big question that's kind of blown this research wide open. Is it just about the bacteria invading? Or is it about how our own unique genetic code tells our body to react to that invasion? So here's the deal. Our genes are basically the instruction manual for how our bodies respond to a threat, like an infection. But here's the thing. Not everyone's manual reads exactly the same. Tiny little variations in our genes can change the instructions. For some people, variations in genes like these ones here basically tell their immune system to, well, turn the inflammation dial all the way up to 11. So for that person, the exact same gum infection could trigger a much, much bigger and more dangerous reaction throughout their entire body. It creates a kind of perfect storm for complications. Okay, we've gone deep here. We've talked bacteria, the bloodstream, even our genes. But what does it all mean for you in the real world? What's the big takeaway from all this science?
After you sort through all the different studies and all the complex biology, it really just comes down to this. We might not have every single tiny detail figured out just yet, but the direction all the evidence is pointing is overwhelmingly clear.
This quote just says it all, doesn't it? We really have to stop thinking of our mouth as being separate from the rest of us. It's not. It's a gateway to the rest of our body, and its health is totally interwoven with our overall health, and never, ever more so than during pregnancy.
And that's the bottom line. That's the headline. Taking care of your gums isn't just about avoiding cavities or making sure your teeth look nice. It is a fundamental part of prenatal care. It's a proactive, powerful way to help protect both mom and baby.
You know, this connection between our gums and pregnancy is just such a powerful reminder that the human body is one amazing, interconnected system. It really makes you wonder, right? What other profound links between different parts of our health are we just starting to discover? What's the next surprising connection that's going to completely change how we think about staying healthy?